What if I told you right now your child could have scoliosis progressing their spine and you would have no idea? It's not because you're a bad parent, and it's not because you're not paying attention, but it's because these early signs are so small and subtle that they're frequently missed. Now, most children with scoliosis are not diagnosed until the curves have become moderate or possibly even severe. That means by the time that you actually notice something going on, the window for the most effective treatment options is likely already passed. In the next few minutes, I'm going to show you 5 specific warning signs that most parents and even doctors miss. And I'm going to show you how you can actually look for these right from your own home. In the end, I'm going to go over the Linchpin, which is the critical window of when it's most important to catch scoliosis so you can get the most effective treatments. Now, you may have noticed something small. Maybe you've noticed one shoulder looks uneven or higher than the other. Maybe you've noticed that their clothes don't, hang or fit in their body perfectly symmetrical. And you probably just chalked it up as bad posture or your child's lazy and hunching over. Another thing is your child or adolescent is not likely to come to you and tell you that they've noticed something off in their body. In fact, most teenagers are more likely to try to cover something up than to come tell you about it. And they're not likely to come and tell you that they have pain because most of the time in teenagers, they do not have pain related to their scoliosis. Hi, I'm Dr. Chris Google, specialist in the non-surgical treatment of scoliosis and hyperkyphosis and head clinician at Scoliosis Denver. And after seeing over 6,500 patients over an 18-year time span, I can tell you the most preventable outcomes are typically the ones that had early signs or symptoms that no one either noticed or paid attention to. So in this video, I'm going to walk you through 5 warning signs that every parent needs to know. And in the end, I'm going to show you how to have confidence in checking your child for signs of scoliosis so you can actually catch it early on and have time to do something about it. Point number 1 is uneven shoulders is not necessarily a sign of bad posture. One of the most common early signs of scoliosis, especially scoliosis in the thoracic spine, is one shoulder being higher than the other. You see, when someone develops scoliosis, their spine starts to twist and rotate and it bends. And as you get a bend in the thoracic spine, on the side of the scoliosis, that shoulder is typically going to be higher than the other side. And for adolescents, that's usually on the right side. So typically you're going to see the right shoulder higher than the low shoulder. Now, most parents just chalk this up as bad posture, or that's the side they always carry their bag or their backpack on, which is causing one shoulder to be higher. This is why a lot of times parents or even teachers will tell their child to sit up or stand up straight. But no amount of postural correction is actually going to change a spine deformity. And one of the reasons this is so easy to miss is teenagers and even children nowadays are known for sitting or standing with horrible posture. They sit and they lean and they hunch forward, they slouch to the side, a lot of times after playing video games or looking down at phones all day. So when you see someone with bad posture or abnormal posture, it doesn't typically strike you as abnormal because that has almost become the norm because it's so common in our society today. I can't tell you the number of parents, when I meet with them, they told me that they noticed some things were off. They noticed that the shoulders were uneven. They noticed their clothing was not hanging on their body normal. Even a lot of times once we find someone has scoliosis, parents will look back at prior photos and they will notice things they didn't even see, like one shoulder being higher than the other or their clothes hanging unevenly on their body. So if you're noticing one shoulder higher than the other, just realize this is not likely related to posture. It's likely due to the spine growing deformed. It's likely not just a postural issue. It's not likely because they're just slouching or they're carrying their bag on one side all the time. So here's what I want you to do. Take your child, ideally with their shirt off, and I want you to look at them both from the front and the back. And I want you to look and see, do you notice one shoulder higher than the other? And if you notice that, that is one of the most common signs that they may have scoliosis or something else going on in their spine. So the uneven shoulders is a very common sign, but the second sign is scoliosis shows up at the same time, but it's frequently missed. Now, one of the things that separates true scoliosis from bad posture, or what some people call pseudoscoliosis or functional scoliosis, is rib humping. You see, scoliosis is a 3-dimensional spine deformity, and the spine grows deformed. Now, sometimes people think they see scoliosis, but it's actually just bad posture. But there's ways we can check to find out, is it truly scoliosis or is it just a postural issue? And that is by evaluating rib humping. You see, as the vertebrae grow asymmetrical, they start to twist and they rotate. And as the spine twists and rotates, that causes the ribs in the thoracic spine to create a hump. Because the vertebrae are spinning, the rib cage actually humps up on that side. Now, what we can do to detect for this is something called a Ford Adams bending test. And how you do this, you have your child put their hands together like they're praying. They're going to put their arms straight and then they're going to lean forward with their arms hanging straight down. And then you want to look at them from behind, and you're looking for any humping in the thoracic spine. Now, if it's just a fake scoliosis or pseudo or functional scoliosis or that postural issue, that humping is going to go away. But if it's true scoliosis, you're going to be able to see that humping. Now, this can also happen in the lumbar spine, but in the lumbar spine, it's harder to detect because you don't have a rib cage there. You can still get humping from the spine rotating and having the musculature higher on that side, but it's going to be harder to detect. And if they have what's called an anatomical short leg, they have a short leg on that side, which I'll talk about later, that actually tends to hide it, making it even harder or more challenging to pick up. Now, here's something of interest. There are no official scoliosis screening programs in the United States. And there's about 3 reasons for those. One of the reasons they got rid of those is they found that they weren't very effective, meaning they weren't very accurate at finding and detecting scoliosis. 2, they thought that there was too many false positives. And when you do a scoliosis screening and you think there's a sign of scoliosis, they may have scoliosis, then what you do is you order an x-ray. And the x-ray is the gold standard to rule in or rule out scoliosis. So what they said is there was too many people where they thought there was scoliosis, they got an x-ray, and there actually wasn't. In reality, big deal. It's much better to have an x-ray and not have scoliosis than to not take one and miss the scoliosis and to miss the most effective window of opportunity to treat the scoliosis. And the third reason was, at one time it was deemed that non-surgical treatment options were not really effective at treating scoliosis. It was thought the only thing that could really help scoliosis effectively was surgery. And so if it wasn't going to actually do anything to prevent surgery, why do the screening? So the screenings were deemed unnecessary and unhelpful. And so at one time, all screenings were banned. Because of that, all screening programs were eliminated in the United States. Now, one of the reasons they were very ineffective or not accurate is they didn't use the most important tool, a tool called the scoliometer. They were just eyeballing it or looking for visual signs. They weren't actually measuring it with an instrument. And the scoliometer is an instrument that's used to measure rotation in the spine. It's just ran down the spine while the child is doing that forward Adams spinning test. And when you see at least 6 degrees of rotation in the thoracic spine or 4 degrees of rotation in the lumbar spine, that's a positive sign of scoliosis. And that's enough to actually order an x-ray where the scoliosis is ruled in and ruled out. Now, because there's no scoliosis screening programs in the United States, first of all, almost no one's checking. Many pediatricians do check for scoliosis. However, I talk to pediatricians all the time, and I've never talked to a pediatrician that uses, most of the time never even heard of a scoliometer. So if they are doing scoliosis screenings, they're probably still doing them relatively inaccurately, and they may still be missing scoliosis. So here's what I want you to do at home. Have your child today with their shirt off, put their hands together like this, arms straight forward, bend over, look at them from behind, look to see if you see any humping in the thoracic spine or in the lumbar spine. And if you think you see anything at all, don't hesitate, go to a scoliosis specialist and get a more thorough evaluation. So now that you understand about rib humping and how that's associated with scoliosis, there's another sign that's directly linked to the rib humping. So if you're finding this helpful and you want to keep learning how to protect you or your child from scoliosis, hit the subscribe button and the bell icon so you're notified, because I release practical scoliosis information every single week that's specific for parents and patients that want answers, not just unnecessary resources. Now, the third sign of scoliosis is directly related to the rib humping. This is called scapular winging. Now, scapular winging is when one of the shoulder blades sticks out more than the other. It's usually protruding or popping out from the rib cage. Now, unfortunately, many providers and physical therapists, maybe even chiropractors, chalk this up as muscular imbalance or muscle misfiring, and they think that it's a musculature issue. But the reality is the number one reason for scapular winging is because the spine rotates and creates that rib humping we just talked about that causes the shoulder blade to pop out on that side. In fact, what happens is the spine's going to twist. As you get scoliosis, the trunk and rib cage twist, and in the thoracic spine, that's typically it's twisting back and to the right. That will cause your shoulder and shoulder blade to move out of the way, and it'll come around the front, causing the scapula to stick out in the back, or what's called scapular winging. So the way to look for that is just look at your child from the back with their shirt off. Look at their scapula. Look to see, are they the same height on one side, or does one seem higher than the other? Look from the side. Does one stick out more than the other? That would be the winging. And if you think there's winging, you also do that forward Adams bending test we just talked about, and that's going to further help confirm or deny the possibility that it's caused by scoliosis. Now, point 4, uneven hips tell a story most people never read. Now, the fourth earlier warning sign of scoliosis is hip or pelvis asymmetry. Now, one of the things we frequently see in patients with scoliosis is they often have an anatomical short leg. What that means is the legs on one side are not as long as the other. Now, when the legs are shorter on one side, that's going to cause the pelvic to tilt, meaning the pelvis will be low on the side of the short leg. That's called a pelvic obliquity or unsquare, unlevel pelvis. And as the pelvis tilts from a short leg, there are several things that can happen. One of those is their body often shifts out of balance. When you have a short leg on one side, they typically have a scoliosis in the lumbar spine on the same side, and the body tends to shift out of balance and lean towards that side. And when you have a short leg on one side and the body is out of normal balance, that can affect many things. It can affect how a child stands. They're putting more weight on that side. That can start to cause knee or hip problems. It can affect how your child moves, and you start to notice some things that really don't look square or right with their clothing. Some of the early signs of that is you may notice that their pants don't seem level. A lot of times you'll see the belt line looks uneven. You may notice that their pants are really baggy on one side, like they're bunching up at the bottom, or they may feel short on one side. In fact, I had one mother tell me that she went back and kept buying her daughter different pairs of jeans because she felt like she couldn't get the sizing right. She always felt like they were bunched up or that they were too short. And the reality is they were, because they were bunched up on the side where her leg was short, and they were too short on the side where her leg was longer because it was pulling them up. It wasn't because the pants were wrong, it's because she had a short leg related to her scoliosis. And what's interesting, parents frequently tell me, looking back after their child's been diagnosed with scoliosis, that they noticed their clothes didn't fit right. They noticed that they were baggy or hanging off to one side. They noticed that their pant legs did not seem even at the bottom. See, think of the spine like a tent pole holding up a tent. If the pole is straight, the fabric hangs evenly on all sides. But if the tent pole starts to lean or twist, the fabric is going to bunch on the inside and it's going to stretch and pull and be tight on the outside. That's exactly what happens with clothing when there's scoliosis going on and the pelvis or the shoulders are out of alignment. The body is the pole and the clothing is the tent. So look at how your child's clothing fits across their shoulders and their waist. If you're consistently seeing asymmetries, pulling or uneven hanging or bagginess, or if their pant legs look uneven, stop blaming it on bad posture or that they just wear their clothes loose or baggy, and realize that maybe due to scoliosis or something else going on in their body. Now, shoulders and hips are two of the areas where parents eventually notice the things after the fact. The fifth sign is a little bit harder to pick up or notice, and that fifth sign is the asymmetrical waistline. You see, it's not just what you see, sometimes it's what you don't see. Let me explain. When you look at a normal person from the front, and if they're relatively lean, you will notice a natural hourglass figure. You're going to have the rib cage, and then on the torso it's going to come in and then out around the hips. But if someone has scoliosis, especially in the lumbar spine, that typically is not present. What typically happens is when you have scoliosis in the lower spine, on the side of the scoliosis, you're going to get a flattening. And on the opposite side of the scoliosis, you're going to have a bigger indentation. So you won't notice that normal hourglass figure. It'll be flat on one side and indented on the other side. Now there's a few other things you want to look for at the same time. When you have a scoliosis in the lumbar spine and possibly a short leg, a lot of times, as I previously mentioned, your body will shift out of balance. And when your body shifts out of balance, a lot of times you're going to have a bigger gap on the side of the scoliosis between your arm and the body. And on the opposite side, you're going to see the arm pinned right up against the body. Also, when you look at them from the front, their head and sternal notch right here will not be lined up with their belly button or the umbilicus. It'll be shifted off to the side. This is another one of those things that parents often tell me they just thought it was bad posture, or with the hourglass, they just never noticed. So here's what I want you to do. I want you to look at your child from the back, ideally with their shirt off. And I want you to look and see, do you see the same shape in their waistline, a normal hourglass on both sides? Or does one side look flat and the other side look indented? Look at the space between the inside of their arm and the body. Is it the same on one side? Or do you notice a big gap on one side while the other side is pinned to the body? And then look at their head. Is their head lined up over their belly button, or is their head and sternal knots shifted to the side? If you're seeing any of those, that tells you there's likely some scoliosis or something else going on like an anatomical short leg. Now, what's interesting, sometimes you don't notice some of these major imbalances on an x-ray because most providers just take sectional x-rays, meaning they may take an x-ray of the lumbar spine, of the thoracic spine, and of the cervical spine. But most of the time they don't take their whole spine together. That's typically only done by scoliosis specialists. These are also called a scoliosis series or full spine x-rays. So this is one of the reasons you need to go to a scoliosis specialist that also takes full spine x-rays to most accurately evaluate your child's spine and their scoliosis. So now you know the 5 visible warning signs of scoliosis. But there's one critical factor that's the single most important thing you need to know. I like to call it the linchpin of scoliosis progression. It's the biggest risk factor of how likely your child's scoliosis progress over time. And it's also directly related to the most critical time to do scoliosis screenings. See, as I previously mentioned, scoliosis is a 3-dimensional growth deformity. And scoliosis typically progresses at times of rapid growth, like during puberty, which happens during teenage years, which is why 80% of scoliosis are adolescent idiopathic scoliosis. They're growth deformities associated with periods of rapid growth. You see, here's how your spine grows over time. When your child is newborn, they grow in really fast, but the rate of growth gradually slows down from birth through about 5 years. And then from 5 to about 10 or when they begin puberty, they actually grow relatively slow, only about 2 inches a year. But once they hit puberty, they take off and grow really fast. Now, girls typically go through puberty about 4 years and boys typically take about 5 years, but they don't grow at the same speed or rate during that time frame. In fact, the first 2 years of puberty, they grow extremely fast. This is called your peak growth velocity or peak height velocity, where they grow the very fastest. Now, after the first 2 years, the rate of growth starts to slow down. This is why curves can go from small to moderate or even severe over a very short time frame. It's typically during that first 2 years of puberty growth or that peak height velocity. Now, what's also interesting is when you're a child and you're growing slow, proportionally, most of your growth actually happens in your limbs or your legs. But during puberty, that shifts. And during puberty, there's a shift where the percentage of your growth actually occurs in your spine. So you have these two things going on. You have the spine starting to grow asymmetrical. You're taking off and you're growing super fast, faster than you have since you were like a toddler. And proportionally, most of that growth is growing in the spine. That's the perfect storm for a small curve becoming a large curve in a very short time frame. Now, it's also interesting, I mentioned that during the second part of puberty, the rate of growth slows down, which is true. But proportionally, the amount of that growth that comes from your spine continues to increase, where the percentage-wise, you get more and more growth from your spine in the later years of puberty growth. So just because you're out of those first 2 years doesn't mean you still don't have a risk of your child's curve progressing. Now, what's interesting about all this, I previously mentioned why scoliosis screenings were banned, but new research, especially research in the last 12 to 15 years, shows that non-surgical treatment options like bracing is very effective at decreasing the likelihood that someone's curve will progress to surgery. But these treatments are also the most effective when they're applied early on when the curves are still small. That's why at Scoliosis, our motto is the right treatment at the right time. And why my personal motto is you have to stay ahead of the curve. In fact, the Scoliosis Research Society, which is the International Society for Scoliosis Surgery, recently came out with a positional statement saying that they do recommend regular scoliosis screenings and that girls should be screened at 10 and again at 12 years old, and boys should be screened between the ages of 13 and 14 because that is typically when they hit that early puberty growth phase. And we want to screen them then so we can catch scoliosis early on and get them the most effective treatments while the curves are smaller. Because without proper screenings, curves don't typically get picked up until they're moderate or more severe. And the window for the most effective treatments has already passed. First of all, do this on any children you have, but especially if you have a girl between the ages of 10 and 12 or a boy between 13 and 14. But because they're probably not getting screened anywhere, if you have a child or teenager, no matter their age, I recommend you check them for scoliosis. And if you suspect scoliosis, take them to a scoliosis specialist to a more in-depth evaluation. And at Scoliosis Denver, we offer free scoliosis from screenings because we know nobody else does those at a very high level. So the signs of scoliosis are very subtle, but they are there. Uneven shoulders, scapular winging, rib humping, asymmetrical waistline, uneven pant legs or anatomical short legs, or the body is simply out of normal balance or shifted to the side. And out of all these things you learn, probably the most important is that critical window of opportunity that we have to catch scoliosis early on, at the beginning of puberty growth spurts. And what we find is the parents that catch this early on, they're not luckier, they're just more informed. And now so are you. Now, if you want to learn the step-by-step process for screening your child at home, including exactly how to perform that Adams forward bending test correctly, watch my video, How to Check Your Child for Scoliosis at Home. I will link it right here at the end of the video and in the description. I'll see you there.